I am Dr. Sharjeel, and today I would like to teach you what you should prepare for your IMBBS OSCE. Now, in OSCE, we have got many stations, like you will have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You will have 12 stations and 5 marks, and you will be asked straightforward questions, like most of the questions will be write down findings, what's your differential diagnosis, what's your definitive diagnosis, or you would be asked name investigations, or how will you investigate, and name treatment options. Now 15, like you will have two pictures, colored pictures from anterior segment, two from the posterior segment, colored pictures. Then you will have one from ocular forma. You will have one examination, ocular examination. You will have one OT instrument. You will have one squint, ptosis, proptosis, one of them. Then these will be present, and you may be asked, now what can be in these? Like in anterior segment pictures, you will be having keratitis, NLD block. You can have Calazian, sty. Then you can have basal cell carcinoma. You can have cataract. You can have VKC with giant papillary conjunctivitis. You can have glaucoma, pseudo exfoliation. You can have rubeosis picture. Then you can have in posterior segment, you can have central retinal vein occlusion, branch retinal vein occlusion picture. You can have AMD, wet and dry picture. Then you can have diabetic maculopathy and diabetic retinopathy picture. You can have retinitis pigmentosa, macular hole. You can have optic disc edema picture or optic disc cupping picture. So these can come in the posterior segment, 2 from here, and you can have here. You can also have trauma corneal tear picture and of thalmitis picture. So you should keep in mind that you will be asked the common things, not the rare things. Then in ophthalmic pharma station you can have atropine, which class it belongs, what are the uses, indications, what are the systemic and ocular side effects. These can be asked. And about atropine, phenylephrine, then pilocarpine, and then you can be asked about anti-glaucoma drugs like beta blockers or brimonidine, prostaglandin analogs, carbonic anhydrase inhibitors. So these can be asked. You can be asked steroids as well, steroids, mast cell stabilizer. So all the drops or all the medications, but these are the common ones which are usually in one station. Then in examination you can be asked about extraocular movements, confrontation tests. Then you have to regurgitation. Then you may be asked about pupil examination. Very rarely we ask about cover tests and ptosis examination. Then in oculoplasty you may be asked about, you may be shown esotropia. You have to then diagnose it, and then you have to tell causes or types of esotropia and then how to correct it. Then exotropia picture can be shown and you have to diagnose it. You have to give the conditions in which exotropia occur, the types, and then you may be asked how to correct it. Like in exotropia, for example, lateral rectus is strong, so you have to weak the lateral rectus recession and medial rectus resection. So then you can be shown ptosis, proptosis, especially thyroid eye disease. So these can be. Then one instrument ocular instrument like eye cannula or artery forceps or bone nibbler, like anything from cataract set, DCR set, and antropion, Calazion clamps. These one among these can be shown. Then instruments, direct ophthalmoscope, indirect ophthalmoscope, 90D, 78 dioptry, IOL, foldable or rigid, it can be placed here. Phaco picture, phacoprobe picture can be placed. So these can, and you have to diagnose it and then answer the specific questions regarding these. So usually and then not all are static stations. 2 or 3 are interactive, and interactive can be of examination, like perform this examination. Then the instruments like slit lamp or tonometer, shots, or applanation tonometer, their pictures are they can be shown, and you have to diagnose it and then tell the parts and the functions. Direct ophthalmoscope and retinoscope, how to differentiate. So these are the few things that you should prepare before the viva and OSCE, and hopefully most of the OSCE will be covered. Thank you very much. And the last thing which can come is investigations. One station like about B scan or OCT or FFA, visual fields, CT scan, MRI. So the questions for this particular station can be what investigation is done. So you have to tell like B scan is done, and what is the disease shown in the B scan, like vitreous hemorrhage or retinal detachment or choroidal melanoma, retinoblastoma. Then you have to tell that what are the other indications of this investigation and how will you treat this disease. Thank you.